Hi, this is Justine Calderwood, owner here at the Healing Spot Physical Therapy. And I want to share my personal healing story because it really helps to explain why I'm so passionate to help other women, especially those with chronic pain. So I'm going to tell you a little bit about just my personal healing story. I'm not going to go into all the details, but I want to give you an idea of just the chronic pain that I was experiencing and where I'm at now. So, to give you a little background, I started having headaches. The earliest I can remember is probably my early 20s when I was in college. And I didn't know why they had started. Maybe it was my backpack, maybe it was my posture. I don't know. I went to my doctor and told him about it, and basically was just told to take some ibuprofen. And so I tried that for a while. Quite honestly, it didn't really do much for me. Then I got into grad school, physical therapy school, and they just seemed to have gotten worse. They were every day. I didn't know why I was having headaches, and I had some hope that during PT school that I would actually get some answers. Maybe my professors would help me out, or I would learn something to help myself. And to be honest, that didn't really happen either. Anytime I'd ask my professors, it was kind of like, it depends. And I didn't really get a straight answer. Part of that's because I never, went in as a patient and had them assess me. So, I was asking them in class, trying to get some free advice. So I totally get why maybe that wasn't the solution for me or the answer. So fast forward, honestly, the headaches were just every day. I remember even before I had my oldest daughter that I sought out treatment. I had some physical therapy. I had also gone to a neurologist, and I was working for a group of orthopedic surgeons. So I remember consulting with the spine guy and ended up at an appointment with a neurologist to try to figure out why I was having headaches. And that provider ended up, we did an MRI, which didn't show anything. And then also just thought it was maybe related to anxiety. So I was given some muscle relaxers and anti-anxiety medication, which I didn't really feel like I had anxiety, but I don't know. But it didn't work. Some other treatments I tried Botox injections where they basically put Botox here to try to deaden my muscles and the tension that I was having. That helped a little bit, but it wasn't something that I wanted to continue long term because it's Botox. It was, poison I was putting in my body. I didn't really want to go that route. The medications weren't really taking care of it either. So every time I would go to a new provider, you fill out the history form and I'd put headaches, and it seemed like every provider had some kind of solution, and none of it really helped, including my dentist. My dentist thought my alignment of my jaw was off, and so I did shaving of my teeth, which is kind of crazy. I wouldn't really recommend that. That didn't help. So I got to the point, quite honestly, that anytime I'd have a new doctor or a new provider, I wouldn't even tell them that I had headaches because I had lost hope that anybody could really help me. And I didn't want to go down the road of trying anything. So I just thought, you know what? I just need to live with this. And quite honestly, I mean, it was really affecting my ability sometimes to concentrate, especially say at work when I was with patients. It was hard for me to not be completely aware that I had a very strong headache. I was irritable. It wasn't really affecting my ability to live my life, so to speak, but I was just on edge a lot of times with the chronic pain. And I think it was, for me, almost worse in a way with this chronic pain is you can't see it, and people don't understand. When you're in pain all the time, you get kind of grumpy. So, not that that was my demeanor all the time, but I know I was kind of short with my kids, and it was just something weighing on my mind of like, is this ever going to go away? Fast forward, I don't know, my mid 30s, I guess, I started getting these brochures for myofascial release. And if you know me and the type of treatment that I do, I really love doing myofascial release as taught by John Barnes. In my mid 30s, I started getting these brochures from John, and they would come like 2 or 3 times a year. And it kind of piqued my curiosity because at first I was like, is this guy really for real? Because he had in his brochure, like, live a pain-free active lifestyle. And I thought, Right. And also, he had this therapy for the therapist intensive program. So I got to thinking, maybe I'm not the only physical therapist out there that has their own pain and hasn't been able to find anybody to help them, hasn't been able to solve it themselves. And I will say, at this time in my life, I was doing all the things. I was doing all the stretches. I was strong. I was running a lot. I was taking care of myself. And for me, it was not a strength issue. It wasn't really that flexibility issue. So after getting those brochures over and over and recycling them, I finally was like, maybe I should pay attention to this. So I ended up saving up some money because the course was pretty expensive, more expensive than I'd ever spent on a continuing education course. And it was in Wisconsin. So I saved up, I went to the class, and I will tell you that class changed my life, not only personally, but also professionally, because I got there thinking I was going to learn some like massage type techniques, mobilization techniques, and it was way more than that. John started talking about basically the mind body connection. He was talking in a different way than I'd ever learned about in physical therapy school or up until that point had come across in anything. And you got to keep in mind, like around this time, I wasn't really big on social media and that, so I wasn't really getting information from social media. And so I went to this class, and like I said, it completely changed my life because he was talking in such a way that at first I thought, what is he saying? It's just so different. But he was talking about consciousness and how physical pain can be also tied into emotional and mental pain and also our beliefs, our thoughts. And I thought, interesting. I wasn't quite sure I believed him yet, but my curiosity was piqued. And so that class, a couple things happened. One, it opened my mind because during this class, I want to give you an idea, there were probably 200 or 300 people in this big auditorium in this hotel, and people started just releasing some of the trauma or injuries, whatever they had had. And so sometimes people were crying or they'd start laughing, or while we're practicing and we're supposed to be like doing the techniques, they were allowing some of the stuff to come bubble up and come out. Some people were just like moving, they were unwinding their bodies, allowing their body to do what it needed to do. All the things that I've learned now are very natural and normal in the healing process. But at the time, I wasn't ready for that. It wasn't I didn't know that was part of healing. Also, I just wasn't prepared for that. It wasn't my expectation of the class. The other thing that happened with that weekend course was my pain started to shift a little bit. And that really got me excited and very curious about what myofascial release is and the potential not only to help myself, but also my patients. So that class I took in 2012. And I brought that information back to the clinic and I started to apply it with my patients. And I started to notice some really great results. People reporting pain relief. And some of my people were starting to explore the mind body connection and allow themselves to feel some emotions and bring up some of their mental stuff that they had, maybe stuffed down. And so I was really motivated to continue to learn. I decided it was really starting to help my patients, and I had a lot of hope for them. And I will say one thing at this point is prior to this point in my career, I had been a PT for about 10 years. And I will say that I had gotten to the point that I did not enjoy seeing chronic pain patients because I just felt like I didn't have the tools to help them. I knew that stretching wasn't going to help them and that strengthening wasn't the answer. In fact, sometimes that made my chronic pain patients worse. They had more pain. And I just felt like helpless, like I didn't have the answers for them. But I will say now, after doing my myofascial release training, I am so much more passionate about treating patients with chronic pain because now I have the tools that I need. So let me explain a little bit more my story here. So 2012, I took that class and then I started to apply it with my patients. I started to take care of myself and do some of the self-care techniques that I had learned and do what I could for myself. And then I ended up seeking out therapy from a massage therapist. And at the time, I was living in Iowa. I couldn't find anybody around. And so I looked in other states, like Wisconsin and Minnesota were pretty close to where I lived. And so I ended up finding a therapist that had advanced training in, I think it was La Crosse, Wisconsin. So I drove 3 hours one way to go get kind of a mini intensive treatments. Like I did 3 treatments back to back over a course of 2 days. And then I went back home, and that started to also help me shift some things. However, I will say that also, along with the self care I was doing, kind of set me into a healing crisis. And I will say around this time, not only did I start that, but I remember I started having some ocular migraines. And if you're not sure what those are, it's basically, it's like affects your vision. So I wasn't having pain with it necessarily, but my vision at times when I would get really stressed out or anxious, my vision would kind of waver and it would close in on me. So I really had this kind of tunnel vision for a temporary period of time, like 30 minutes to an hour. Well, this was happening, and so I brought it up to my doctor, and I didn't know what it was. And she ended up sending me to my like an ophthalmologist as well as a neurologist. And mind you, remember I had gone to a neurologist years ago and felt like that person didn't help me. So I wasn't super excited to meet with this neurologist, but I went. And when I sat down with this gentleman, he did like this very quick assessment of me. And afterwards, he was starting to talk to me about some very basic things and ways I can take care of myself, like applying hot packs and doing stretches. And I was quite irritated, to be honest, because I thought, I've already tried that. That is not working. And so he ended up taking a different approach. And he then, as we sat there, he said, you know what? I'm going to ask you some questions. And he ended up asking me about first my marriage, because he, looking back, like he knew more about the mind body connection than what I did. So he asked me about my marriage, and I was like, my marriage is fine, everything's good. And then he asked me about my childhood, and I immediately started crying. And because I just have some trauma, some emotional baggage from my childhood. And so he said, Justine, I think it would be beneficial if you went and talked to somebody about this that's impartial, that doesn't know your past, and see if they can help you. So he ended up referred me to a psychologist. So I went to the psychologist, and I'll tell you, that was also part of my story, something that really I needed at that time that really, really helped me. So the combination of doing some physical work with the myofascial release, along with some of the talk therapy, one of the tools that my psychologist used was EMDR, and that can help with trauma. And I'll tell you, it really, really helped me. The other thing that my psychologist helped me to learn was about myofascial release, because he kind of had to, he was forced to, because he would do his thing and I would be feeling better. Then I would go to work and I would treat patients. And unbeknownst to me, every time I was getting my hands on patients and doing myofascial release, because it is a form of energy work, I was stirring up my own things. So I would get kind of stirred up, not sure why. And then I would go back, and after a while, he was like, what is going on? Every time you go to work, something changes. So I had to educate him on what myofascial release was. And I was excited about this new technique. And he was the one that actually said, oh, okay, I get it. He was trained in Reiki. And so he knew, some energy work. And so he was able to actually help me professionally and personally, to help me use this new technique in a way that was also going to serve me and my patients. So he really, really helped me out. So around that time, with doing these things, I went into a pretty big healing crisis. So if you have worked with me, if you've been a patient of mine in the past, or if you've been a student of mine of the Release Your Root online course, you know this terminology, and maybe you've experienced a healing crisis, and maybe this is brand new to you. But in 2013, early 2013, I had a pretty big healing crisis that lasted for a little while, months. And it really was an opportunity for me to look at some old beliefs that I had about myself, about the world, as well as an opportunity for me to allow some of those emotions and thoughts and things that I had stuffed down as a kind of a survival mechanism allowed that to come to the surface. But it gave me a chance to really examine it and go, is this still serving me, or is it time to switch this? And, those are things that I did with my psychologist, but also I was able to, through my training with myofascial release, do that for myself as well. So it really helped me to clear out a lot of junk and to really feel better on the other side of that. And I'll tell you, it was messy and it was not pleasant and it was very, very uncomfortable. I got to the point where I had to miss a few days of work, for instance. I just had a hard time concentrating. I was going through so much. I ended up, I won't go into this much, but I ended up admitting myself to an inpatient mental health hospital because of all of the things that were coming up. And that got me into contact with a psychiatrist as well, who was able to help me with some medication that I needed on a temporary basis for, lo and behold, anxiety that really came up big time. And I will say since then, I've been able to wean off of those medications. I needed them for, I don't know, maybe a year or so. And I was able to get through the healing that I needed to. And then I was able to get off the medication, which was my own personal goal. So I realized in all of that, that really chronic pain, I thought it was going to be like one thing. I was going to be able to do one release was going to take care of all of my pain, or I was going to have like one day where I just wake up and, I would be pain free. And that is not how chronic pain works. It typically doesn't come on suddenly. It may, okay, you might have an injury, a defined event or episode, but not all chronic pain comes on suddenly and that there's a defined moment. It can kind of work its way in. And then you're in this period of time where you're just like, gosh, everything hurts, or you're worried about the future. You're worried about if this is ever going to go away, or, it's sucking the life out of you. It's making you tired. It's exhausting. It's making you irritable. At least that was my experience. So what I have found is that chronic pain comes on gradually, or possibly can. And, it can be layers that need to come off gradually as well. And it may need to be looked at through a different lens, or through different, what do I want to say, just like different things may be contributing to it. At least that was my experience. So I ended up learning I'm talking about, a course of years of really diving deep into my healing process, being open-minded to, and being willing to look at my own stuff and start to heal through it. But for me, I realized part of it was physical. I had a car accident when I was 16. I had a whiplash injury. I had a concussion when I was about 17, where I hit the back of my head on some concrete. I had braces when I was a teenager, when I was in middle school. And I really feel like, I had like treatment done on my jaw and some unwinding and things like that. And that led me back to a realization that it came from the braces and some dental work. The other thing that was contributing to my pain was just my childhood. There was some trauma in there, and since then I've healed through so much. And today I feel so much more calmer. I am able to enjoy just being still and being with myself. I told you I used to run. I was just so active and I was just so busy. I had to be busy all the time. And that was part of what was contributing to it. And I think I was so busy because I didn't want to really face the underlying pain that I ended up coming into contact with as I did my healing work. So I just wanted to share this because I really am passionate about helping women, especially with chronic and complex pain, because of my story, because I've been through it. One thing I learned through John Barnes in myofascial release training is he says for us as therapists that you can only take your patients or your clients as far as you're willing to go. And that has always stuck with me. I know I was healing through my own pain, and I had that motivation of I want to feel better. But at the same time, I kind of looked at myself as a guinea pig. If I can get better, then that'll give me the confidence to help somebody else. And the process through that healing journey has really given me the tools to then, help other women and walk through their healing process with them and guide them, not to do the work for them, but to be that guidance, to give them resources, to give them hope, and inspiration. And also, I mean, I share my story in parts with my patients as it's relevant for what they might need to hear that day. So if this resonates with you, if you've gotten to the end of this video, congratulations, it's a long one. But if this resonates with you and you're sitting there right now and maybe parts of my story, you're like, yeah, I've been through that too. I've been blown off, or I've tried several things and they didn't work, or they didn't work to my satisfaction. Maybe you've lost hope. I want you to just hear me and know that if you are in any way local to me, I would love to work with you, have you come on into the clinic here at the Healing Spot. But even if you aren't local, I do have an online class called Release Your Root. And I also work with clients online. So I can guide you, even though I may not be able to get my hands directly on you. There's a lot that we can do, and I can show you through a video and show you how to do some of the self-care as well, and really give you the foundation of what myofascial release is and how it can help you. So if you want a little help, if you would like to chat with me, set up a discovery session where we can sit down face to face in my office, or if you want to do a discovery session virtually, I'm happy to set that up. You can use the link below, or you can head to my website, healingspotpt.com, and just fill out that form for a discovery session, and let's get started. I would be honored and I would be happy to lead you to feeling better, feeling more confident, feeling calmer in your life, and getting rid of whatever baggage is maybe leading to your pain. Thank you for listening.